Now, I would like to call on the podium Ms. Varsha Srivastava, Assistant Director, NABH.
Good afternoon, Ranjan sir. Good afternoon to all the dignitaries present here and the audience. Thank you, organizers, for allowing me to give a presentation. I'm Varsha. I'm working as Assistant Director, NABH. And NABH started its quality journey in 2005, and we will be completing 2 decades now. So, NABH's first accreditation standards, which were developed in 2006, were the hospital accreditation standards. And now, last year on the World Patient Safety Day on 17 September, we have launched the digital health standards also for the accredited hospitals as of now. So this is the slide about NABH, started in 2005, and the first accreditation standards were developed in 2006. The vision of NABH is basically patient safety and quality in healthcare organizations. So, to be the APEX national healthcare or accreditation and quality improvement body, which is functioning at par in the global benchmarks. The vision is to operate accreditation and allied programs in collaboration with the stakeholders, focusing on patient safety and quality of healthcare. So, the way we accredit hospitals and healthcare organizations, NABH itself is an accredited body by ISQA, International Society for Quality in Healthcare. And NABH is an institutional member of ISQA and ASQA also, Asian Society for Quality. This is the cycle what we have. We developed first accreditation standards in 2005, and the 5th edition was launched, and it also got accredited by ISQA. The organization as NABH itself is accredited by ISQA standards as per ISQA standards. Now, what are the core activities of NABH? NABH basically deals with the accreditation of the healthcare facilities. To make more hospitals come into the journey of quality, we have started with the certification programs also. Then quality promotion initiatives like accredited hospitals or certified hospitals, they come to us for the nursing excellence certification, the emergency department certification. These are all the excellence programs. Then the recognition, endorsement of various healthcare quality courses and workshops. IEC activities, public lectures, advertisements, then workshops and seminars. We do virtual trainings also, which are being displayed on the NABH website on a monthly basis. Then education and training for quality and patient safety. We started with one standard, and now we have around 24 accreditation certification standards. So these were the new launches: the digital health accreditation standard, the care home, the dental clinic standards, the entry-level certification for dental clinics, and the stroke centers. This dental healthcare service providers, this 3rd edition was launched, and the allopathic clinic 2nd edition. So now I'll take you through the journey of NABH to develop India's first ever digital health standards. So these standards were developed in collaboration with the government and taken inputs from the government to re-emphasize the importance of technological access to care in the post-COVID world. So in the COVID times, we have realized the importance of digital access to the healthcare facilities. Now, guide healthcare delivery institutions on a roadmap to increasing the healthcare technology advances. So, whatever technology the organizations are adopting right now, so there are standards in NABH guidebook which tell us how they can go about it. Improve the quality of care for the patients, reducing the waiting time. As sir and madam told that the waiting time for the patients get reduced, waiting time for the doctors and all, everything is getting reduced due to this technological advance. Reduce information asymmetry and help patients make an informed choice. The entire health records of patients are available at one place, so patient can go anywhere to any hospital. The health record is available at all times. So first and foremost, the goal is to make the hospital digitized, which will help the patients and hospitals to keep a track of the various health records. The hospital also has the record and the patient also. So outside the hospital, display general information and education material by the hospital, display accreditations, then important notifications. For example, from the pediatrics department, any immunization is due for any child, then the patient attendant automatically receives an intimation that yes, the vaccination is due, you need to come for it, book an appointment online. And digital display to assist patients, digital displays in the hospital, which are there to guide the patients. Now I'll tell you about the process of drafting NABH digital health standards. So the first step was the review of India healthcare landscape to understand the diversity, the size of the hospital, the location of the hospital. Then review of global digital standards and their applicability in India, how they can be put up across the hospitals in India. Drafting of Indian digital health standards from India perspective by leveraging global best practices. We have incorporated our accreditation standards also, some objective elements into this. Internal discussion with the potential users, then the quality experts, the vendors, HMIS vendors, EMR vendors, and the digital health experts. Then incorporation of existing digital health initiatives, for example, ABDM, we have incorporated the inputs from ABDM and their components also, EMR standards, etc. Incorporation of public feedback, we have displayed the standards, the draft is displayed on the website for the inputs from the public. Then the technical review committee reviews these standards and then the final drafting is being done. So these standards, what we have drafted in the digital health, they have three maturity levels basically: silver, gold, and platinum. So for the hospitals to achieve these levels, they need to go through certain compliances. Leverage NABH's existing structure and maturity levels. We have three maturity levels here. I'll tell you in detail about it. Every level is important, so we have set up minimum qualification for each level. So whatever you require for the silver, what for gold, and what for platinum. Consider clinical and non-clinical areas and a more focus on the clinical areas. So these digital health standards have 8 chapters total, and the initial three chapters are patient-centered and the 5 remaining chapters are organization-centered chapters. Keep fewer number of maturity levels. We have kept 3 levels as of now. Incorporate ABDM requirements and elements to ensure compliance by the hospitals. Unified set of objective elements to be leveraged by all segments of hospitals, irrespective of geography, ownership, and size, as per the relevance and applicability in a hospital. Now, what are the benefits for adopting these standards? These standards, if you adopt, you can deliver high quality of patient care by improving the understanding of digital health technologies, provide roadmap to hospitals to improve their usage of digital technologies, present an objective framework to rank different hospitals on their usage, reducing the information asymmetry to help patient make an informed choice, increase healthcare accessibility and affordability, and reduce the chances of any potential medical error that may happen due to the manual oversight. Now, the outcome of drafting of these healthcare standards was giving thrust to sustainable development goal of healthcare, then benefit in universal health coverage, make in India a developed nation, and especially alignment with the Honorable Prime Minister of India's vision of digitized nation and developed nation. So these are the basically 8 chapters what we have developed. 3 initially at AAC, COP, and MOM. These are the patient-centered, and the rest chapters are the organization-centered. These are the 3 levels of maturity index: silver, gold, and platinum. So for silver level, we have done like core commitment should be there. Achievement and excellence is not required in this. For gold level, you need to have core commitment and achievement level also. And the platinum level has all the 4 stages. This will be an accreditation program, so it will be of 4 years. The accreditation will be of 4 years, and in between 24 months, we will have the surveillance assessment. So the future of accreditation, as we stand at the precipice of a new era in healthcare, the fusion of technology and medicine has the power to unblock boundless possibilities for patient care and organizational efficiency. Embracing this digital transformation is no longer an option, but an imperative for the hospitals for today and tomorrow. Then digital health accreditation aspires an organization to leverage digital health technology in providing patient care. It enables the organization in demonstrating commitment to quality and patient safety. The integration of digital health technology can help healthcare organizations improve the quality and safety of care they provide, and to increase efficiency and reduce the cost also. Then digital health accreditation program can help healthcare organizations demonstrate that they are using digital technologies in a way that meets high standards for quality, safety, and effectiveness. As of now, NABH has launched these standards and they are applicable for the accredited hospitals only. But way forward, we will be moving ahead with the non-accredited hospitals also. So these are the India's first digital health standards to ensure the safe and secure use of digital health solutions to improve overall clinical care and the quality ecosystem in the country. These standards are intended to be used for the assessment of digital processes implemented by the organization for providing patient care services. And as it is first of its kind in India, it is expected to lead a higher level of performance and a stronger focus on patient care to ensure that the organizations perform evidence based practices. So as of now, we have hospitals, about approximately 100, 147 hospitals who have registered for, and the assessments have already happened. So we urge the hospitals, accredited hospitals as of now, that they can apply. And if you have any query, you may contact us through these links. Otherwise, the details are available. These standards are freely available on the NABH website also. You may download the PDF version and go through these standards. So thank you so much.
Thank you, Varsha ma'am, for sharing your insights on the functioning of NABH.